Hello everyone. So let us study today about occipito posterior position mechanism of labor. See, when the head is towards like this, towards the pubic symphysis, it is occipito anterior. If the occipit is behind, it is occipito posterior. Okay, so occipito posterior is most common in android and anthropoid type of pelvis. So most common position of occipito posterior is right side, right occipito posterior. Okay. See, this is right occipito posterior. This right occipito posterior, it can undergo long arc rotation and can become occipito anterior. And then the mechanism of labor is like normal, whatever we have studied in the behind video. Okay, so that is occipito anterior. That is long arc rotation. See, it is there in the posterior quadrant, occipito posterior. It has to rotate into occipito transverse. After occipito transverse, it should go into right occipito anterior. Then comes direct occipito anterior. So 1/8, 1/8, 2/8, and 3/8 of the circle. So it will rotate 3/8 of the circle. Think about the twist which happens in the neck. So it should sustain that much of the kink which happens in the neck, right? So it can rotate into 3/8 of the circle and can become occipito anterior, and then the mechanism of labor is normal. Or it can undergo short posterior rotation, that is 1/8 of the circle, and can become direct occipito posterior. Okay, I will tell about direct occipito posterior mechanism of labor. Or it can undergo short anterior rotation but only 1/8 of the circle and becomes occipito transverse, right occipito transverse, and further mechanism of labor may not progress. Then it becomes deep transverse arrest. Or it will not rotate at all. It still lies in the persistent occipito posterior position, and hence the mechanism of labor won't happen. So it can arrest in two places. One is persistent occipito posterior or in the transverse position and becomes deep transverse arrest. So when it comes direct occipito posterior, it engages in direct occipito posterior position. Same engagement is seen. The biparietal diameter crosses the pelvic brim. Then it undergoes descent, and then here it is again flexion only. Engagement, descent, flexion. With the flexion, it undergoes internal rotation. Internal rotation is 1/8 posteriorly. So 1/8 posteriorly, occipit is directly behind the sacral promontory. Internal flexion. Then comes not extension. You should not tell the word extension when it is the mechanism of labor. It is the flexion. See, the head comes by flexion. The head comes by flexion. That is phase to pubis delivery. Phase to pubis. Phase to pubis delivery. So here also they will ask what are the structures which will comes first. The phase to pubis delivery, it is the vertex. Then comes the brow. Then comes the face. Okay. This is how the part presents when it is delivering. That is, the head delivers by flexion, and then head delivers by flexion, then undergoes restitution, and then undergoes restitution, and then shoulder comes behind the pubic symphysis. Again the next is seen, that is posterior shoulder delivers, which is then followed by anterior shoulder, and then the rest of the body delivers by flexion. Okay, this is about the mechanism of labor in occipito posterior position. So from the starting, if they ask how you should tell is, lie is longitudinal. Again the presentation is cephalic. Presenting part is vertex, and the denominator is occiput. Now the position of the baby is right occipito posterior, ma'am. Okay, when the head crosses the pelvic brim, that is the engagement happened with a further descent, further flexion, and the internal rotation happens. Now the head delivers by 1/8 posteriorly. Okay, then comes further descent with further flexion. Now the head delivers by flexion. And the rest, that is the event which comes is occiput, then comes the brow, then comes the face. Then the shoulder rotates, restitution happens, and then shoulder comes in the anterior posterior diameter. That is how the external rotation happens, and then head delivers by shoulder delivers, and then rest of the body delivers by lateral flexion. This is about the mechanism of labor in case of occipito posterior position. Remember, they will ask the definition of what is lie, what is attitude, what is position, denominator. Lie is longitudinal axis of the fetus to that of the longitudinal axis of the mother. That is, lie is longitudinal. It can be transverse or it can be oblique. Okay, so that is about lie. Then comes presentation. Presentation is the part which occupies the lower pole of the uterus. Then comes presenting part. That is the part in the presentation which occupies the internal os or which can be palpated when you do the pervaginal examination. Then comes the denominator is the bony prominence which occupies the lower pole of the uterus or which occupies at the level of the internal os. That is the denominator. Then attitude is the relationship of the different body parts of the fetus to each other. Okay, and the position is the relationship between the position of the baby to that of the different quadrants of the pelvis. Either it can be anterior, direct anterior, or just right occipito anterior, or right occipito left occipito anterior, then comes right occipito transverse, then comes right occipito posterior, or it can be direct occipito posterior. This is about the position of the baby. So this is all about the mechanism of labor in occipito posterior position and the definition of different terminologies. Thank you.